In light of the COVID pandemic, people are spending more time in their homes than ever before. But while this helps slow the spread, it brings a greater problem to the surface, one that Detroit residents have been afflicted by for decades.
I stay indoors all the time, for the most part. And other effects, it's been physical as far as, breathing issues, eyes burning, nose, nausea.
My mother and my sisters from particularly the east side of Detroit, they have really bad asthma attacks.
We live like across the street from Detroit. The air quality over there was bad. I used to suffer from asthma. Went to the emergency a couple of times.
Detroit has a really strong reputation as the automobile capital of the US, but what many people overlook is all the air pollutants that come as a byproduct of this. For residents to have to breathe this air in the comfort of their own homes, there is no excuse. 35% of Detroit lives below the poverty line, with 80% of the housing stock over the age of 60. Between dust, lead, and infiltrating car chemicals, the health consequences only skyrocket.
I know that a lot of people have been going to the hospital a lot more for asthma and breathing treatments. The majority of the houses around here were built over 100 years ago. This house here is over 100 years old. A majority of them still have radiator or steam heat, basically what you're talking about, or hot water heat. They have radiators and hot water runs through that heats the air. So no ventilation whatsoever, other than from an air conditioner or the windows. So if you open your windows, you gotta let the mess in.
Especially in my mom's area, which is Du Bois and Woodward area.
Okay.
The houses are very older, and their house is still heated from coal. Mm-hmm. That's how old the houses are.
Oh wow, yeah, just way outdated.
Yeah, it's way outdated, and they can't afford to update it,
As of February 2022, the EPA listed 188 hazardous air pollutants. HAPs have all been known to develop adverse health effects ranging from asthma to cancer. If we are to stand any chance in preventing this health crisis, we need to consider pollutants as a whole. Both major and minor criteria hurt people all the same. The sooner we come to realize this issue at a policy level, the sooner Detroit's residents can have a breath of fresh air. Many states that harbor heavy polluters tend to put emission regulators into effect, known as Maximum Achievable Technologies, MACT for short. One place to start is by pushing Michigan to develop a MACT for Detroit specifically.
I would like to see an overhaul in the policies and practices of EGLE.
Change is something that only happens when people stand together and are knowledgeable about the problems they face. With that being said, we need to educate not only ourselves but those around us when it comes down to injustice like this. While many Detroiters struggle to make ends meet, it is truly up to us to make a difference wherever we can. Whether it's raising money, calling policymakers, or simply educating those around us, only we can offer a helping hand when our neighbors are in need.
That they should really put more of a funding for this situation, or maybe grants to help individuals that cannot afford better circulation through their house.
Currently, Detroit is ranked 15th in asthma rates across the entire US. Unless anything is done, that number only climbs.
We've got to start putting people in front of a dollar.